Second white coat. Subscribe and like. Let's learn medicine together.
All right, let's dive into a real medical detective story. This one starts with one of the weirdest symptoms you can imagine, and it ends with surgeons finding something totally unexpected deep inside a patient's brain. Okay, just picture this for a second. What if a seizure didn't just happen all at once, but instead it started a slow, methodical march up your body? I mean, starting in your foot, then climbing up your leg, moving to your torso. It sounds like something out of a sci-fi movie, right? But believe it or not, this is a real thing, and it's the central clue in the mystery we're going to unravel today.
So, let's start our investigation with clue number 1, this bizarre marching seizure.
Yeah, there's actually a name for this orderly progression. It's called a Jacksonian march. It's what's known as a focal seizure, which just means it starts in one very specific spot. And here's the really wild part. The seizure's journey across the body? It's a direct mirror image of an electrical storm spreading across the brain's motor cortex. It's like the seizure is tracing a finger along a map of your body that's laid out right on the surface of your brain. Pretty incredible.
So, let's meet our patient. He's a 30-year-old man, and he's dealing with exactly this. His seizures kick off in his left leg and just march their way up. Now here's the problem. The usual anti-seizure meds, they're not doing a thing. So doctors do some neuroimaging, they take a look inside his head, and bingo, they find the source. It's a single, small area of abnormal tissue, what doctors call a lesion, right in his motor cortex. And get this, it's on the right side, which is the exact part of the brain that controls the left side of his body. The location is a perfect match. The big question is, what is this thing?
Well, since the medication wasn't working, there was really only one way to figure out what this lesion was. They had to go in. And what the surgeons found in there was, well, it was something they wouldn't forget.
So in the OR, they find this mass, about 1.5 centimeters, but it wasn't like a typical solid tumor. No, this thing was described as being made of all these engorged, purplish clusters, all packed together.
In fact, the description they used was even more specific and really memorable. The surgeons called it a mulberry-like lesion. Think about that. That vivid, visual clue turns out to be absolutely crucial for cracking this case.
Okay, so the lesion is out, but the investigation is far from over. Now the mystery moves from the operating room to the pathology lab. It's time to go deeper, to see what clues are hiding under the microscope.
And wow, under the microscope, that mulberry just transforms into this incredible image. You see countless dilated, almost cavernous-like spaces, and every single one is filled with blood. These are definitely not normal blood vessels. It's a tangled mess of these huge malformed channels.
This right here leads them to a definitive diagnosis, a cerebral cavernous hemangioma. You might also hear it called a cavernous malformation, but really, what is it? It's basically a cluster of abnormal, super wide blood vessels in the brain. And the most important part is that their walls are incredibly thin and weak. Why? Because they're missing the normal muscle and elastic tissue that's supposed to give them strength. They're like faulty plumbing.
So let's just break down what we're seeing here, because it's pretty unique. You've got these huge widened spaces, these caverns, lined by just a single layer of cells. They're separated by really thin, flimsy tissue. But the most critical piece of the puzzle is what's not there, that smooth muscle that gives normal blood vessels their strength. This fragile setup, this microscopic structure, that's the key to the whole mystery.
Okay, so we've got a diagnosis. But how does a tiny cluster of faulty blood vessels cause a seizure that literally marches up a person's body? It's time to connect the dots. The connection here is actually pretty fascinating. See, because those vessel walls are so fragile, they're always constantly leaking tiny amounts of blood into the brain tissue around them. We're not talking about a major hemorrhage, but more like a slow, chronic micro-leak, a constant drip, drip, drip. Over time, all that leaking blood really starts to irritate the super-sensitive brain cells, and that irritation is what eventually triggers the abnormal electrical storm that we call a focal seizure. And just like that, the whole mystery is solved.
But you know, in medicine, a huge part of being sure you have the right diagnosis is ruling out all the wrong ones. It's like a detective story. You have to eliminate the other suspects. So let's take a quick look at the imposters and see why they didn't fit.
So our main suspect, the cavernous hemangioma, it fits every single piece of evidence. The mulberry look, the dilated vessels, all of it. But what about the others? Well, it couldn't be a glioblastoma. That's a really aggressive cancer, because there were no cancer cells to be found.
And it wasn't a berry aneurysm, because that's a bulge on a major artery, not a mass inside the brain tissue itself. The view under the microscope also let them rule out other things, like ependymoma or Kaposi sarcoma. This whole process of elimination, it made the diagnosis totally ironclad.
All right, so let's boil this whole thing down. What are the key takeaways? If you remember anything about cerebral cavernous hemangiomas, remember these 3 things. First, visually, think mulberry in the brain. Second, microscopically, it's a tangle of super thin-walled leaky blood vessels. And third, the mechanism. Those tiny chronic leaks are what irritate the brain and kick off the seizures. Mulberry, leaky vessels, irritation. Got it?
It is just incredible when you stop and think about it. This tiny, benign cluster of faulty vessels can create a symptom so precise that it literally maps a journey across the human body. It really makes you wonder, doesn't it? What other secrets, what other amazing stories are hidden away in the unbelievable architecture of our brains?